Thank you, Dr. Laurie, and thanks for working with us on this piece of legislation. Hopefully we can continue to work together to perfect it in a way that we can here in Congress, if there is such a thing.
Great collaboration.
Yeah, thank you. And I just want to follow up on Mrs. Capp's line of questioning. It was just a point of issue that I hope you can help us with is during an emergency, from a terrorist attack or as we saw with H1N1, it's critical that there is a point person, somebody that makes the decision, somebody that is absolutely in charge. It's not CDC, it's not NIH, it's not the FDA or anyone else. It's you.
That's right.
How can we improve the functions at HHS to ensure that you are, in fact, in charge of the preparedness efforts? And we understand HHS does work on the consensus model brought by peer review and other things. But in this particular case, I think it's incredibly important that there is a person in charge, or it takes longer, as you know. How can we help you clarify that?
Thank you, and I very much appreciate the question. The original intent of the legislation was to do just that, and I have found through this experience that indeed I have the authorities that I need to be in charge. We have strengthened our policy coordination and our preparedness planning with all of the entities involved. So, how you're going to, being in charge during a response also requires sort of being in charge and providing that policy direction in all the preparations so that when the balloon goes up, you're really ready.
And do you find you have that?
And I find that the collaboration with the sister agencies in HHS, I don't think it's ever been better. We are working extremely closely together. I think they recognize and respect the fact that we provide policy direction and are in charge. And I think all of the efforts that we've undertaken to coordinate across HHS have done that. Now, during response, it's really the Secretary's Operations Center run by the Office of Preparedness and Emergency Operations in my office that is the belly button for those activities, the central coordinating point for our operational response, and it's my office as well that is the central coordinating point for the strategic and policy response. And that has become increasingly recognized with each of the events that we have dealt with this year. And I very much understand that I am in charge and that I am accountable, and I think I have the authorities that I need to do that.
I'm not so interested if you know you were in charge, because I think you do. It's the other folks at the table I want to understand that you're in charge.
I appreciate that.
Yeah, thank you. I'm going to move to the FDA here for a minute. Last year, the HHS conducted a comprehensive medical countermeasure review. In that review, you identified the need to improve regulatory science at the FDA to ensure medical countermeasures are given a priority. Specifically, you said the FDA needs, and I'm going to quote here, to work with sponsors to identify and help resolve scientific issues as early and efficiently as possible, end quote. And I couldn't agree more with that statement, and I think that's absolutely critical. Countermeasures are different than the next generation of, they're different from Viagra, they're different from whatever, clearly. And so having the FDA involved early, to me, is incredibly important. Can you explain why improving regulatory science at the FDA is so important in your view?
Sure.
And why early intervention may be different and is important in countermeasures as it is different from other drugs?
Let me do the early intervention part first, if I can, because I think it will help explain better the regulatory science piece. If a company is developing a product and gets either hung up scientifically or has a pathway to regulation that's not as clear as it could be, it's really hard for that company to go forward. We have, as I think you know or have heard, really transformed the way in which we work with companies so that now at the beginning, at the get-go, we do what I affectionately as a primary care doctor call case management. We sit down with scientists from FDA, NIH, CDC, BARDA. We look at what the plan is. We provide scientific input and expertise, and then now on a very regular basis, we sit down, review the process and the progress with those companies, and try to troubleshoot. And FDA is now at the table and a very active participant It's been very welcomed by companies, and I get feedback about that all the time. Now, if in fact you are moving along on a plan to develop a product and to get it approved or authorized by the FDA, and for example, you don't have the tests necessary to know how effective it's going to be, the time to develop those tests isn't when the company is ready to submit a dossier to the FDA. The time is very early on in the development process. A great example of that has been, the sterility testing for flu vaccine, which hadn't changed for 30 or 40 years. Now, we are doing things early on to work with FDA and companies to change that process. So what you need are the tools. You need the scientific tools to evaluate whether a product is going to be safe and effective. And the science has changed so rapidly that we need to be able, and we have to ask FDA to use new science, not antiquated science, to do its job. That means that it has to be at least at the pace of, or a step or two ahead of where all of these companies are, so that when the companies are ready to have their products evaluated, the science is there to do that. Animal models are another great example. We're working hand in glove with NIH and FDA on developing those kinds of animal models so that at the end of the day, if an animal model is an appropriate way to move forward, we can do it. So regulatory science becomes central to being able to get a product approved and to clarifying and I think speeding up a regulatory pathway.
And early intervention with those folks is
much earlier
critical.
intervention.
Yeah.
And we have been doing that, as I said, since the Secretary's countermeasure review. It seems to be working quite well. In that early intervention, we sort of make a plan. And the vaccine front, we've moved forward with also working on some timelines so that we and BARDA, the sponsor, FDA, agree on the plan, agree on timelines, and we manage to those.
Great. Thank you.